As if COVID-19 wasn't bad enough, new data suggests the virus has been widening housing disparities by race and income as well. In the previous episodes, we highlighted the many racial disparities that exist in the United States. We have seen how racial and ethnic minorities have suffered under policies of displacement, and how crucial the need for affordable housing really is. Communities of color throughout the United States have continually been crushed by housing cost burdens and housing instability, which in a large part is born from structural racism and historical discriminatory housing and lending practices. The last episode also showed us the large number of people paying 30% or even 50% of their incomes to housing. A large percentage of those households were Black and Latinx. Last year, we also saw the home ownership gap between Black and white households reach record highs. During the Great Recession, communities of color, specifically Black and Latinx communities, suffered from foreclosures and rapid house declines occurring throughout the nation. The loss to household wealth incurred during this time has not been recovered. Despite the strong economy of the past few years since the Great Recession, housing cost burdens for many low-income renters have soared. What's up, everybody? I'm Will and this is The People's Health. Welcome to the second part of a two-part series on affordable housing. In this episode, we're going to look at how COVID-19 has widened the housing disparities gap by race and income. We're also going to explore 7 myths associated with affordable housing. Glad to have you back. Let's get into it. Black and Latinx communities have been the hardest hit by measures put in place to slow or stop the spread of COVID-19. Measures like stay-at-home orders disproportionately hurt these communities, as they have a legacy of occupational segregation that has led to the overrepresentation in low-wage jobs, and in the kind of jobs that cannot transition to remote work. The unemployment rate for Hispanic Americans in September dropped to 10%, from a high of 18.9 in April, but for ages 16 through 19, it was 19.6. But this doesn't just affect communities of color. Although they are the most affected, around 31 million people either met the definition of unemployed or were on temporary layoff according to data released in early October. The official definition of unemployed also leaves out workers that are sidelined by the crisis or are absent from their jobs without pay, or even those that want a job but aren't currently looking, which include business owners that have been shut down by the pandemic or those concerned about getting a loved one sick. If we include these families, the numbers could be close to 54 million Americans. The Pulse survey conducted by the US Census to see where the state of Americans is during the pandemic showed in early October that a high share of Americans, 22 million adults, and almost 12 million adults with children in fact, reported that their household, sometimes or often, didn't have enough to eat in the last 7 days. In the last 3 years, homelessness has also been on the rise, reaching over 567,700 people during the pandemic. If this continues, experts estimate that 250,000 people could join this high number by the end of the year. That's 750,000 homeless people in the United States. So not only has the pandemic caused unemployment numbers and homelessness to rise, it has affected the health status of communities of color, as they already have disproportionately experienced many of the pre-existing conditions that are dangerous with coronavirus. Diseases such as hypertension, asthma, heart disease, and diabetes are just some of them. It's important to note that these health disparities are linked to environmental, economic, and political injustices that have led to issues such as food insecurity, exposure to harmful pollutants, poor housing conditions, and other inequitable living conditions or situations that essentially are harmful to health. There are other underlying factors that exist as well, and that may prove problematic once a vaccine is released to the public. Fear, distrust, and discrimination are very real in these communities and may discourage some communities of color from seeking medical assistance. Immigrant families, especially those who are undocumented or mixed status, may choose not to go to the hospital for fear of immigration enforcement. For African American communities, historical and present oppression in the healthcare industry has led to distrust. As the data suggests, the kind of policy and programmatic response for the COVID-19 crisis and its impact on housing cannot be a one-size-fits-all approach. We need race-conscious interventions that address the needs of renters and homeowners of color. Additionally, policy solutions should focus on making sure the needs of lower-income renters who faced housing instability before the pandemic began and now face a greater risk of eviction are met. It is important we hold our elected leaders accountable. Policies and programs that can help communities in need may be on the line. Get informed and vote. Shifting to something a bit lighter. We've all heard some of the myths associated with affordable housing and how it has led to some of us becoming NIMBY types. What are NIMBYs? Not in my backyard. The people that may support things like affordable housing but don't want it built in their communities. So what we're doing here is dispelling some of the myths that led to NIMBY thinking when it comes to affordable housing. The first myth is that affordable housing drives down property values. Now this one is popular with NIMBYs as it potentially affects their pockets. Turns out it's not true. In fact, repeated research has shown that affordable housing has no negative impact on home prices or on the speed or frequency of sale in neighboring homes. According to the National Low Income Housing Coalition, 85% of affordable housing meets or exceeds federal quality standards, and over 40% of this housing is considered excellent. So that means affordable housing is either on par with the surrounding neighborhood or even in some cases in better condition. Second myth, affordable housing looks cheap and undesirable. Okay, so builders of affordable housing have to comply with all the restrictions on design and construction standards as market rate projects. Furthermore, since affordable housing projects are often taken on with public money, they have additional restrictions and higher standards than market rate housing. The truth is that because affordable housing is built with public and private funds, it makes it less costly to live in, not because of lower quality construction. In Chicago, many nonprofit housing developers like the Lake County Residential Development Corporation, or the LCRDC, provide strong examples of high quality, affordable housing that blends in with market rate housing. Number 3. Affordable housing hurts the quality of local schools and lowers standardized scores. First, don't get me started on standardized tests, but this one is also a big false. Education is near and dear to my heart, and as a former teacher, I've seen the effects that children experience when not being able to stay in the same school for long, due to their families becoming trapped in a cycle of rising rents and frequently trying to find living space that they can afford. This can directly affect their grades and influence lower test scores. When a child has a stable home and can remain in a single school system, their test scores rise. They're also able to build long-term relationships with their peers, teachers, and mentors, all which are key to increasing performance in elementary and secondary schools. Finally, it also increases chances of these children attending college. Number 4. Affordable housing is a burden on taxpayers and municipalities. Here's another argument meant to impact your pockets, but yet again is false. In fact, affordable housing actually enhances the local tax revenues. One way it does that is by improving or replacing a net plus on the tax rolls. Throughout the nation, the effective tax rate, or the property tax paid relative to the market value for multifamily complexes, is significantly higher than single-family homes. In other words, multifamily homes pay their fair share in local property taxes. Affordable housing owners and renters also actively contribute to the local economy in the taxes they pay, the money they spend in local businesses, and in how, in the case of owners, increase property values and revenues in a neighborhood. Myth number 5. Affordable housing brings increased crime. The biggest boogeyman of all. Perhaps the mindset stems from this kind of thinking.
What is your concern when it comes to Section 8 and low income?
The lifestyle, I feel like, goes with Section 8 is usually working single moms or people who are struggling to keep their heads above water. And it's not, I feel so bad saying that, but it's not, it's just not people who are, I guess, of the same class as us, which sounds bad, but I don't mean that in a bad way.
Truth is, there are no studies that show affordable housing brings crime to neighborhoods. Affordable housing, when used as a tool of economic development, often lowers crime rates. The National Crime Prevention Council cites the construction of affordable housing lowering crime rates due to neighborhood cohesion and economic stability being enhanced as these families seek the same thing that every family does: a safe place to raise children and the opportunity to enhance the value of what they own. Myth number 6. Affordable housing is just another government handout. Not sure if you heard this one before, but like the others, it's a big no. It isn't the poor who benefit the most from federal subsidies. It's the wealthy homeowner. Hear me out. Homeowners receive tax deductions for things like mortgage interest and also write-offs for property taxes paid. In 2003, these subsidies cost the federal government $87.8 billion, while building and subsidizing affordable housing cost only $41.5 billion, according to the Department of Housing and Urban Development. Myth number 7. And the last one on this list is that affordable housing only benefits the very poor. Everyone else pays. False. The reality is that the lack of affordable housing negatively affects employers, seniors, poor people, immigrants, entry-level and service sector workers, and public sector professionals such as teachers, firefighters, and police officers. It also means that tax revenues are not in place to improve roads, schools, or air quality. It means businesses struggle to retain qualified workers or lower the amount of money available to spend in those businesses. Effectively solving the affordable housing crisis does not mean addressing the needs of just the poor. It also means addressing the needs of the business community, working and middle-class families, and the broader population. I'm hoping this second episode in this two-part series on affordable housing sheds some light on the need for it and help dispel some of the myths about it. In the next episode, we'll take a look at redlining and what it is, its history, and the effects we see today on the health of communities of color. If you have anything you want to share, including topics you might want to see explored on this channel, don't forget to leave a comment below. Also, more importantly, don't forget to subscribe. Click the bell for notifications on new episodes, and of course, like this video. I'll see you again in 2 weeks. I'm Will, and this is The People's Health. Remember, take care of yourselves and each other. Peace.